Title: Unleashing the Booby Trap. The Grim Reaper bows to the battle against breast cancer since the 90s. TLDR. Kiss of death from breast cancer? Nah, not today, bro. Back in the 90s, the 5-year risk of cashing in your chips from breast cancer was a hefty 14%. But now, it's shrunk faster than a cheap t-shirt in a hot wash, sitting at a mere 5%. Even better, over 60% of women diagnosed between 2010 and 2015 were looking at a low 3% 5-year risk or less. Once upon a time, back in the grunge-filled days of the 1990s, a breast cancer diagnosis was almost as terrifying as those acid-wash jeans everyone was wearing. 1 in 7 women were sent to the cosmic shredder within 5 years of being diagnosed. Grim much? But guess what? We're not in the 90s anymore, Toto. Science has gone all Hulk on breast cancer's butt, and the results are as juicy as a summer watermelon. Now, the average 5-year mortality rate from breast cancer is a measly 5%. That's right, from a whopping 14% back in the 90s down to a 5% today. That's a drop faster and steeper than your favorite roller coaster. If you want even more awesomeness, get this: for more than 60% of women diagnosed between 2010 and 2015, their 5-year risk of meeting the Grim Reaper was a puny 3% or less. Pretty rad, right? So, what does this mean for all you ladies out there? Basically, if you're diagnosed with early breast cancer today, there's a solid chance you're going to kick it to the curb and be a long-term survivor. The booby trap ain't what it used to be. This is some seriously heartwarming news that should be giving both patients and their doctors a reason to celebrate. So, if you've got your party hats on, it might be time to blow those whistles. But hang on, let's not start doing the Macarena just yet. Breast cancer is still a monster of a disease, and nobody is saying it's been totally defeated. But isn't it good to know that we've made such epic strides in slaying this beast? Now, here's the kicker: what made this happen? Was it all those pink ribbons, the midnight charity walks, or was it something else? And if we did it for breast cancer, could we do it for other types of cancer, too? Don't get complacent, folks. Yes, we've made great progress, but there's still a fight to be fought. So, keep checking those mammaries, and remember, early detection is your best defense. Disclaimer: this article is meant for informational purposes and is not to be taken as medical advice. Always consult your healthcare provider for personalized advice regarding these issues. So, what do you think? Have we really turned the tide in the fight against breast cancer, or are we celebrating too soon? And if we can do this for breast cancer, why not other cancers too? Is this the dawn of a new era for cancer survival? What's your take? Let's get the discussion rolling.